If you are over 60 and dealing with burning, dryness, or irritation that just will not go away, I want to ask you something. Have you ever considered that the solution might not be another cream, another lubricant, or another prescription? That it might be something completely natural, something women in Japan have been doing quietly every night for generations, and that nobody in Western medicine ever thought to tell you about. Japanese women suffer from these symptoms at a rate 4 times lower than women in the West. Same age, same menopause, but a completely different daily habit. Today, I am going to share that daily habit with you. It takes less than 2 minutes before bed. It costs almost nothing. And if you are over 60 and dealing with burning, itching, or dryness that never seems to get better, this may be the most important thing you watch this week. Stay with me until the end because I will also tell you what happens to your body when you do not do this. And it is not something you want to ignore. Hello, I am Dr. William Harrison, a gynecologist who has spent over 20 years helping women over 60 with their intimate health. Before we go any further, write in the comments "getting worse" if your symptoms have been getting worse despite everything you have tried. Or write "starting now" if you are ready to actually do something about this tonight. I read every single comment. Let me tell you about Patricia first. She is 67 years old and she came to see me 3 years after her symptoms started. At first, it was just occasional dryness. But over time, it became a constant burning that never went away. She could not sleep properly. She could not exercise comfortably. She had tried 5 different lubricants from the pharmacy, 2 prescription creams, an aloe vera gel that helped for maybe 40 minutes and then everything came back worse than before. What Patricia had never tried was something simple, a specific natural oil applied every night before sleep, not to cover up the symptoms temporarily, but to actually help the tissue heal while she slept. I showed her exactly how to use it. At 3 weeks, the burning had reduced significantly. At 6 weeks, it was gone. At 10 weeks, she came back and said something I will never forget. I forgot what it felt like to not be thinking about this. Now I remember. That is what we are working toward for you today. And if this is giving you hope, please subscribe to this channel and turn on notifications. I share practical, honest women's health information after 60 that most doctors simply do not have time to discuss in a short appointment. Now let me explain what is actually happening in your body. In plain language, no complicated terms. After menopause, your body stops producing estrogen the way it used to. Estrogen was the hormone that kept your intimate tissue healthy, moist, and comfortable. Think of it like a daily moisturizer that your body used to apply automatically from the inside. When that stops, the tissue gradually becomes thinner, drier, and more sensitive. It loses its cushioning. It loses its natural moisture. The protective environment that kept bacteria and irritation away starts to break down. And here is the part most women are not told. This does not just stay the same. It gets worse over time if nothing is done. Every week, without proper care, the tissue becomes a little more fragile, a little drier, a little more reactive. The burning gets more constant. The itching gets harder to ignore. Clothing that used to be fine starts to feel uncomfortable. This is why doing something about it now, tonight, matters more than waiting. The good news is that this tissue can be helped. It responds to the right care. And the right care is much simpler than most women think. The oil I am going to tell you about is rice bran oil. You may not have heard of it for this purpose. Most women have not. But this is exactly what Japanese women have been using for generations as part of their intimate care routine. It is pressed from the outer layer of rice grains. It is completely natural. And it works on your tissue in 3 specific ways that make it different from any regular lubricant or moisturizer you have tried before. First, it actually helps your skin produce more of its own collagen. Collagen is what keeps tissue thick, elastic, and resilient. Rice bran oil contains a natural compound called gamma oryzanol that gently signals the tissue cells to start rebuilding. This is not temporary. This is your own tissue actually getting stronger over time. Second, it is rich in a very powerful form of vitamin E that protects your tissue cells from damage and improves blood circulation in the area. Better blood flow means more nutrients and oxygen reaching the tissue, and more nutrients mean better healing and more natural moisture production. Third, and this is the part that surprises most women, rice bran oil has a natural acidity that is almost identical to healthy, intimate tissue. Most commercial products actually disrupt the natural balance of this area. Rice bran oil supports it. This means fewer infections, less irritation, and a more protected environment for the tissue to heal. Now, here is why you cannot skip nights. Think of it like watering a plant. If you water it consistently, it stays healthy and grows stronger. If you water it only sometimes, only when it looks like it is dying, it never really recovers. It just cycles between barely surviving and drying out again. Your intimate tissue works the same way. It needs consistent nightly support to rebuild and maintain itself. Skipping a few nights does not undo everything, but it slows the healing significantly. And on the nights you skip, the drying and thinning process continues without anything to resist it. This is why Patricia had been stuck for 3 years. She was reaching for a lubricant only when the burning became unbearable, treating the symptoms in the moment but never giving the tissue the consistent nightly care it needed to actually recover. Once she started the nightly routine and did not skip, everything changed. Here is exactly how to do it. Every night, as the very last thing before you get into bed, after any washing or brushing teeth, take about half a teaspoon of cold-pressed rice bran oil. You can find this at any health food store or order it online. Make sure it says cold-pressed and unrefined on the label. Warm it slightly by rubbing it between your clean fingertips for a few seconds. Then apply it gently to the external intimate area. You do not need to insert it. Just a gentle, thorough coating of the outer area is enough. The oil will naturally move and be absorbed during the night while you sleep. This takes about 60 to 90 seconds. That is the entire routine. In the morning, there will be no residue. Nothing to rinse off. Just go about your day normally. Wear loose cotton underwear to bed, or sleep without underwear if you are comfortable with that. Cotton allows the oil to stay in contact with the tissue and do its work. Synthetic fabrics absorb the oil and reduce its effectiveness. 4 things that will make this work even better. 1. Take a 400 IU vitamin E capsule orally every evening alongside the oil application. The vitamin E works from the inside while the oil works from the outside. Together, they are significantly more effective than either one alone. 2. Drink at least 8 glasses of water every day. This sounds simple, but it makes a real difference. When your body is dehydrated, your intimate tissue is one of the first places it shows. No oil can fully compensate for chronic dehydration. 3. Add 2 tablespoons of ground flaxseed to your breakfast every morning. Flaxseed contains natural plant estrogens that gently support the intimate tissue from the inside. Sprinkle it on yogurt, oatmeal, or anything you normally eat. It has almost no taste and it builds up benefit over 4 to 6 weeks. 4. Stop using any scented soap, scented wipes, or any product with fragrance in this area. Fragrance is one of the biggest hidden irritants for already sensitive tissue. Plain, warm water to wash the external area is all you need. Here is what to expect honestly week by week. In the first week, many women notice less acute burning almost immediately. The oil creates a protective barrier from the very first night that reduces surface irritation right away. In weeks 2 and 3, the itching that often comes and goes starts to reduce. The tissue is beginning to feel less raw and reactive. In weeks 4 to 6, this is where real change starts to happen beneath the surface. The tissue is rebuilding. Women at this stage often say things feel less fragile, less sensitive to clothing and movement. In weeks 8 to 12, most women who have been consistent describe a level of comfort they had given up hoping for. Clothing is no longer uncomfortable. Sleep is no longer disrupted by itching. And for many women, the idea of intimacy, which had felt impossible, starts to feel possible again. Patricia at week 10 did not need to describe anything in detail. She simply walked into my office, sat down comfortably in the chair, and smiled. That said everything. Here is what you do starting tonight. Go to a health food store or order online. Cold-pressed unrefined rice bran oil. Pick up vitamin E 400 IU capsules. Buy ground flaxseed. Tonight, before bed, do your first application. Tomorrow morning, add flaxseed to your breakfast. Start drinking your 8 glasses of water, and do not skip nights. Vaginal atrophy gets worse without consistent care, but with the right nightly routine it responds, it heals, and it improves. Your body is not finished. It simply needs the right support given consistently. Start tonight. Share this video with a woman who is suffering and does not know this exists. Leave me your comment, getting worse or starting now. I am Dr. William Harrison. 2 minutes before bed. Every night. That is all it takes to start changing this. I want to address something that comes up almost every time I talk about this with patients. Many women tell me they feel embarrassed buying something like this. They feel like they are admitting something, like they are drawing attention to a problem they would rather keep private. I understand that completely. But I want you to hear this clearly. Cold-pressed rice bran oil is a cooking oil. It is on the shelf next to olive oil and coconut oil. Nobody at the checkout counter knows what you are using it for, and even if they did, taking care of your body is nothing to be embarrassed about. It is the most sensible, practical thing you can do. The women who feel embarrassed and do nothing are the ones whose symptoms keep getting worse. The women who feel embarrassed and do it anyway are the ones who come back to my office 3 months later looking completely different. There is one more thing I want to be honest with you about. This oil will not solve every situation. If your symptoms are very severe, if you have bleeding, if the burning is extreme and constant, if you have frequent infections that keep coming back, please see your doctor. There are medical treatments including localized estrogen therapy that can help in more advanced cases and that are very safe when used as directed. The nightly oil routine is not a replacement for medical care when medical care is truly needed. But for the majority of women over 60 dealing with mild to moderate symptoms, the kind that are making daily life uncomfortable but have not yet been addressed, this simple nightly habit can make an extraordinary difference. Rice bran oil works best as a preventive and restorative practice. The earlier you start, before the tissue becomes severely thinned, the faster and more complete the results. If you are watching this and your symptoms are still relatively mild, starting tonight gives you the best possible outcome. If your symptoms are already more advanced, it will still help. It will just take more time and more consistency. Either way, starting is always better than waiting. One last thought before you go. I have been a gynecologist for over 20 years. I have seen thousands of women. And the one thing that consistently separates the women who improve from the women who do not is not the severity of their symptoms. It is whether they do something consistently. The women who do a little something every night, even something as simple as this 2-minute oil application, almost always see improvement over time. The women who try something once or twice decide it is not working fast enough and give up, almost never do. Your body is not a machine that responds to a single input. It is a living system that responds to consistent care over time. Give it that care. Starting tonight. I also want to mention something about coconut oil, because many women have heard about using coconut oil for this purpose and wonder if it is the same thing. It is not. Coconut oil is a good natural moisturizer and it does provide some surface relief, but it does not contain gamma-oryzanol, the compound that actively signals your tissue cells to rebuild collagen. It does not have the same vitamin E profile as rice bran oil, and its pH is more alkaline than your intimate tissue ideally needs, So while coconut oil is not harmful and is certainly better than most commercial products, rice bran oil is specifically and meaningfully more effective for the tissue restoration we are trying to achieve here. If you already have coconut oil at home and want to start tonight before you can get rice bran oil, using coconut oil tonight is better than doing nothing. But make getting rice bran oil your priority this week. The other question I hear often is whether this is safe to use if you are also using a prescription cream or other medical treatment. In most cases, yes, but always check with your own doctor first. Rice bran oil is a food-grade natural oil with no known drug interactions and no systemic absorption. But your doctor knows your specific situation and should always be part of that conversation. What I can tell you is that in my practice, many women use the nightly rice bran oil routine alongside other treatments without any issues. In fact, many find that adding it extends the benefit of their other treatments and allows them to use less over time. Your body is telling you something every time it burns, every time it itches, every time it wakes you up at night. It is not telling you that you are old or broken or beyond help. It is telling you that it needs something it is not getting. Tonight, you can start giving it exactly what it needs. 2 minutes. Cold-pressed rice bran oil every single night. That is your starting point. Everything else can build from there.